What you're going to see me doing today is I'm going to be assisting the doctors, but my main job is to set up the instrument tables and maintain the sterile field and pass the instruments to the surgeons.
Well, my role here today is the circulator. And the circulator, a lot of people call circulators gophers. And that means we go for stuff. Because once the surgeons and the scrub techs get scrubbed in and gowned and gloved and get in all the blues, they are no longer unsterile. And anything they need or want, I have to get it for them. And my job is to take care of the patient first, make sure they're comfortable in the position on the patient correctly, work with anesthesia, put the patient to sleep or whatever the anesthesia department needs. And like I said, get the surgeons and the scrub techs whatever they may need. And we try to, in the rooms, have everything we need without having to go out the room to get it. But sometimes there are things that we have to go out and get, and that's what I do.
I will be opposite Pam at the foot of the table, and what I will be doing is I'll be manipulating the leg so as to expose what the doctor needs to be working at the time. Whenever he's cutting the ball of the femur off, I bring the leg around. I kind of look like a wrestler because it will be moving the leg. We'll dislocate the joint. I'll hold the leg. Whenever he's putting the prosthesis back in, there are a lot of, there's some technical skill. It looks like you're not really doing anything, but there is technical skill to that because you want to have everything to where the doctor doesn't have to struggle.
I'll be working closely with the CRNA, with the Certified Registered Nurse Anesthetist, and together we'll be providing the anesthesia start to finish. So the anesthesia doc will come in typically on induction as we put the patient to sleep, but throughout the case, the CRNA and myself will be providing all the anesthesia.
My job as an X-ray tech in the OR is to provide all the physicians that need C-arm assistance, which is fluoro, which is radiation, so they can actually see what they're operating on. I'm their eyes, so to speak. So it's just certain cases that they need X-ray. They don't need X-ray on every case, but it's certain different procedures that they need X-ray.
Surgery has always been my love. I don't know how to do anything else. I've been doing this a long time, and I like the technical part. I love the instruments, and orthopedics is like construction, drill saws, nuts, bolts, screws, and I just enjoy that.
You don't wake up knowing this. It comes with experience, but you have to have a willingness to learn, and you have to have a willingness, and you have to have an outer shell that things bounce off of you. But if you come into the atmosphere with a good attitude and you want to do the very best, because this is about patients, this is about taking care of people, their needs, they hurt, they have afflictions, and you have to derive a satisfaction from knowing that you're helping people, and that's where the special person comes in, because not everybody can do that.
There are so many different modalities to X-ray, so it's not just X-ray. When you go through a basic technical school, they would teach you the fundamentals of X-ray. So that's taking basic X-rays, but you can expand from that, where you can do CT with this which is called computed tomography. You can do MRI. You can do nuclear medicine, radiation therapy, ultrasound, PET scans. It's just so many different other avenues that you can go into that you don't just have to be pigeonholed into just one thing. So the field is wide open.
When I went through school, I knew that I wanted to do an advanced degree. And to do a nurse anesthesia degree, you have to be a critical care nurse in the first place. So I went directly into a burn unit when I came out of school, and did an ICU training, and then worked in a burn unit. That was in Colorado, and that's a requirement for nurse anesthesia. You have to work for a year or two, at least, in critical care.
Well, I've been a nurse for, let's see, 1984. What's that? 26 years. And I worked in several areas of the hospital. And the last department I worked in was on the surgical floor here. And one of the nurses and transportation guys used to come around all the time and say, "You need to come work in the OR." I said, "No, I can't do that. I can't stand that." So anyway, one day I tried it, and I ended up liking it. The one thing I like about it is the patients come in, whatever their ailment is or whatever, you heal it, you fix it, and they get well and they go home. As opposed to on the floor, you know, the patients kind of linger and you see them every day and they seem like not to get better or whatever. And I just kind of like this, and I like hands-on stuff a lot. I like hands-on. I like dipping in, diving in, and just getting at it. Okay. So that's what I like.
I know that I have derived a lot of success. I've had a lot of good experiences. I've had some bad experiences, but that's what makes life. And you have to put on a hard coating. You have to come in dressed to work. This is not for, as we've said before, it's not for squeamish people. It's not for people who don't want to work. It's not for people who basically want to draw a paycheck. You can draw a paycheck at Walmart.
You can't be lazy. You have to come in here and be willing and ready to get to work and just not slack off. And if you got a team that's hardworking and everybody likes what they do, and it just flows. You know, it's nothing like a car that runs well. You know, well-oiled machine, so to speak.
Well, I've been in the medical field basically all my life. You know, I started out when I was 17, like I said, in the military, and now I'm 40. So, like I said before, you have to find something that you like to do. I love what I do, so I work at 2 different hospitals, and I don't feel like I'm working because I love what I do. I have a passion for what I do. I don't do it for the money. I do it because I like it.